Good afternoon. I'm Ellen Leahy. I'm the health officer for the Missoula City County Health Department with the daily COVID update for the last date of July. Missoula County received 12 new COVID positive tests since yesterday. That brings our total number of active cases to 69. We had been running for the past week closer to 60 active cases at any given day, and so that is a bit of an uptick. But do keep in mind that the reproductive rate, or also known as the transmission rate, which is one of the epidemiological indicators that we follow and that Cindy Farr talked with you about yesterday, still pretty low, and that is where we want to keep it. And one of the ways that we keep it there is asking you to keep your number of contacts very low. And we watch that as another indicator of how we're doing in the community right now. We have 239 close contacts to the active cases that are being monitored under quarantine for symptoms. I expect that number will go up because we haven't fully investigated all 12 cases and identified all of those contacts. We do try and usually are able to do that within 24 hours of receiving a case report. Our average number of contacts per case is an indicator we keep a close eye on, and it's been running at about 5 since we've got into the stage 2 of the reopen. So that's a pretty good low number. That's very important as a measure of, if a case does occur, how much exposure and potential spread happens. And so that's why we keep an eye on that, and that's why we ask you individually to keep your number of contacts low. We are still seeing workplace clusters. Again, the storyline is real similar to what you've heard before. Pretty good protection and precautions and following of rules and guidelines being taken when working with the public, and then a relaxation of those when out of the public view, such as breaks or sometimes after hours or staff meetings and those types of things. The virus doesn't take those breaks, it takes those opportunities to spread. So another reminder that keep those precautions in place at your workplace. We are actually seeing a little bit more percentage-wise of community spread now than we are workplace clusters, and so that's another indicator we want to keep an eye on. At least with a workplace cluster, we know where it came from and we know who to work with to try to push back and stop that spread. With community spread, that's an indicator that we have more cases out there, that it's a little bit more difficult to try to stop some of that spread. So again, keep the numbers of people you hang out with and the way in which you do that, keep that on the low, please. With that in mind, we've had a lot of confusion about quarantine and isolation and self-quarantine and self-isolation, and I know we've talked about it before, but as more people are experiencing a quarantine because they were exposed to a case, because they have become a close contact, it's a good time to try to determine again what the purposes are and what the distinctions are between those two situations. First of all, you can voluntarily self-isolate, self-quarantine. Your boss or the person holding your event, or you can, those things are done of your own initiative, and they are precautionary moves that anyone can take. You can travel and decide that you're going to lay low for a week or so after travel, or you're not going to visit a high-risk person. Those are all fine precautionary things, and we hear the words quarantine and isolation. However, the health department, by state statute, and the health board, is required and authorized by law that when someone does have COVID-19, that person must be placed in isolation. And likewise, a close contact, someone who is exposed to that person in a way that could transfer that disease to them, must be placed in quarantine. And so that's official isolation and quarantine, and that is, again, required and can only be done by the health department or an agent of the health department under the health officers and the board's authority. And likewise, a person who's been placed into official isolation or official quarantine cannot be released from that situation except under the authority of the health officer, and that's by state law, and of course we follow CDC guidance. So what is common in the underlying purpose for quarantine and isolation is, in either case, we're trying to stop spread from a person who's known to be contagious or a person who may be or be becoming contagious, spreading that disease to another susceptible person. And so they share the same purpose, but a person who has the disease is known as a case, and that case will officially be placed in isolation. And they will stay in isolation for this particular disease, based on evidence and CDC guidance, at least 10 days. And they must also, before being released, have 24 hours of no fever without fever-reducing medication, and they must have significant reduction of symptoms, if not resolution of symptoms. So a case who has the disease is contagious for at least those 10 days, and perhaps longer if they still have a fever or they have cough. So those are the parameters that we use before someone can officially be released from isolation. A close contact is a person that, again, we apply a certain definition based on the disease and the evidence about that disease. And that does change with a new disease such as COVID, but the current definition is someone who was within 6 feet of the case, the known COVID positive, for at least 15 minutes. And that person is considered a contact. And that 15 minutes can involve a judgment call. It can be a cumulative 15 minutes. So perhaps you didn't spend a whole 15 minutes on a break time with that person, but have you been within 6 feet crossing back and forth of each other in your office setting or whatnot? If so, then that will meet the definition of a close contact. So again, for the same purpose that isolation has, quarantine has the purpose of not spreading the disease to others, and in this case it's the possibility of the contagion. So that person, by law and by board policy, will be placed in quarantine, and it's home quarantine unless they don't have an adequate home quarantine. And then we do have a non-congregate shelter at the Sleepy Inn that we do operate for people that need that resource. And they have to be in quarantine for the full incubation period of that disease. And we get a lot of confusion about quarantine, official quarantine. Again, it's imposed by law. It has to be the full incubation period. Only those that meet the definition of a close contact would be placed by the health department into quarantine. They will be monitored daily for the development of symptoms. With the development of symptoms, be tested to see if those symptoms are COVID. If they are COVID, then they become a case. We interview them for any other contacts and so on and so forth. Where things get confusing with quarantine and difficult is that person doesn't feel ill when they go in. And to be quarantined, removed from work, your normal life, your plans for 14 days when you feel healthy is a tough situation to be in. And there's always more people in quarantine than there are in isolation. And that is a function of how many people you or somebody else may expose if you develop the disease. So once again, keeping those close contact numbers down. Another point of confusion that has arisen with official quarantine is we do now test people that are close contacts. We test them during the quarantine period. We don't test them too early because the test could be a false negative, but it's very possible that we may have tested them at a time where the disease hasn't developed enough yet to actually give a positive test. So they get a negative test, they feel well, and they understandably believe they should be out of quarantine. Well, if they were self-quarantining, they could, but they've been under official quarantine, the purpose of which is to stay for the full incubation and the potential um, contagious or appearance of contagious period for this disease, which is 14 days. So that is the distinction, and it gets back to our two basic control measures for pushing back the numbers and slowing the spread of this disease. The most preventive one is that distancing and masking and keeping your numbers of close contacts really low at all times at the workplace, at other times in your personal life, so that you don't get it and so that you don't expose more people. We get a lot of cooperation with that. Our numbers are good, but they are starting to tick up. And so it's a good time to, I think, thank everyone who's helped push them back as much as you have so far, but to remind yourselves that this is the way it's going to be for a while, and please hang on to that as we get through the rest of summer, as our students start to try to go back to school, as our university comes back into session. We want to keep our numbers of close contacts very low. Thank you.